Hello everyone, this is Dr. Kazi, and in this video we are going to learn about the anatomy of the abdomen. We're going to start with a very basic overview of abdomen, and then we will proceed to the more difficult topics. The reference book which I am using for this topic is Snell's Clinical Anatomy. As a matter of fact, this is really easy to understand. Anyway, let's get started. The abdomen is the region of the trunk between your diaphragm and the pelvic inlet. Let's assume we have the diaphragm here and here is our pelvic inlet. So the whole area between your diaphragm and the pelvic inlet is the abdomen. It's a very soft region with a very little bones and consists of your liver, spleen, stomach and pretty much everything. Let's have a look at the skeleton of the abdomen. Remember, this skeleton don't protect the abdominal organs. It provides a very poor support and protection. In fact, it just provides the attachment side of the muscles. Thoracic cage, which covers the upper parts of the abdominal organs. On the lower side, we have the iliac and the pubic bones. The cavities of these bones contain very few coils of intestines. Let's take out one lumbar vertebra and study its features. Now, I really hate complex diagrams like this. Let's make it simple and easy. Have a look. The body is big, round, and massive like a kidney. It's the center of a whole vertebral foramen for the passage of spinal cord, of course. We have transverse process and the spinous process. These are the attachment sites of the muscles. While studying abdominal anatomy, you don't have to go into the details of the lumbar vertebra, but a few points should be remembered, like the body is big and intervertebral disc, which is the disc between the two vertebrae, is wedge-shaped. The parts of the thoracic cage which is relevant to the abdomen are the pointy little thin xiphoid process of the chest bone, the costal margins of the 7th, 8th, 9th and 10th costal cartilage, the lower two ribs, 11th and the 12th rib. 12th rib has a single facet for articulation with the 12th thoracic vertebra. The anterior end of the vertebra is pointy, like the General Aladdin rocket has to be pointy. Os coxae, which consists of the ilium, ischium, and the pubis. This is the lateral surface because here we have the hip joint. The fossa, right here, articulates with the head of the femur. The medial side of the hip bone is very important. It is divided into two parts by the arcuate line. The upper surface has a little concave cavity which is called as the iliac fossa. The surface which is below the arcuate line is flat. This was all about the abdominal skeleton. In the next video, we will learn about the 7 layers of the abdomen, and it is going to be easy and interesting. So don't forget to like, share,